This is just a crash course on how to do a hard stick. So I get all my stuff ready and have it in preparation. This is one of my patients that's a pretty hard stick. She's a post-gastric bypass patient. So she had some chronic dehydration right after surgery. So my first step is getting a good tourniquet. I like to do it super flat so it's more comfortable to the patient. I think that this ended up still bunching up a little, but do it flat like that with a little knot that you can just untie really fast, okay? And then I palpate the vein. It doesn't matter what it looks like. What it matters really is how it feels. She has a super tiny vein right there that we got. I like to slap on it a little bit and then also use an alcohol swab for it to show up a little more, but I also rub my finger along it. That can help it pop up a little more as well. Those are a few of my tricks. And I like to use the arm to position. So make sure that you're comfortable. That's super important, to make sure that you are comfortable and the patient's comfortable, but also use their body to help position you and help hold that down, that vein, so it doesn't roll. So here I'm cleaning with the alcohol swab to help it pop up a little bit and can just give me better visibility. And we got her today with a 20 gauge in the smallest vein. So I like to go with the direction of the vein. So it's kind of going at a little angle. So I'll make sure and want to just barely stick. And I sometimes fill it more and hold the arm in position. I do this for hands too. I use the hands to hold the vein in the right position. I clean it again after I touch her skin. And then we will go in for a very superficial stick. I hold down her arm. I make sure I'm comfortable. There we go. We're going along where the vein is going, which direction it is. So we stick with the bevel up. I usually tell my patients to wiggle their toes. It can help them from vasovagaling. I think I stuck a little far, so I pulled it out a little and then waited for blood return. And once I get good blood return, then I'm just going to advance that catheter, pull that, because the veins can blow if you don't pull it fast enough, the tourniquet. And then we hook up our IV and it's done. Then we want to make sure and stick it down. The best thing is to have all your stuff ready and according to your hand dominance, whatever side you're on. Take my sharps away and I make sure that she is comfortable. So if you have any more questions about hard sticks, and I can hopefully answer them for you.